Our second speaker of the day is Dr. Birnie. Katie is a clinical psychologist and assistant professor at the University of Calgary in a couple different departments. She also leads a partnering for pain program there. So I'll let her continue with her little bit of intro and about her. And yeah, looking forward to hear your talk today, Katie.
Awesome. I'm really excited to be here. It's really nice to meet everybody. Context, I'll just add to some of the information Isabel put up there. Prior to taking on my role at the University of Calgary, I actually worked at Alberta Children's Hospital for about 2 years, supporting you through the rheumatology program, and also through some of the other programs like our headache migraine clinic and so on. So I've really had the privilege of getting to work with youth. And then I've previously worked in adult care when I was in Toronto before in Calgary. So with folks both in their teenage years, but also into adulthood, dealing with rheumatological conditions and all of the different things that can come with that. So I spend a lot of time supporting folks dealing with pain now, but recognize that there are lots of pieces outside of that, and that pain is not always there for everyone, or not always a hardship for folks with rheumatological conditions, but so many other things, whether that's dealing with treatment, living with a chronic condition, friends, family, mental health, school, work, all of the life parts of it. So really happy to view our conversation today in that bigger picture, which I think is so important. So I have a couple of slides I wanted to share. And I was listening to the last bit of Andrea's talk, and so much I'm so appreciative of the focus of this day and the conversations about mental health. And I really wanted today to try to also make it a bit experiential. So recognizing people might be tired too, or people might be, sounds like already have some experience engaging with mental health professionals, which is fantastic. And really wanting to share an opportunity to have some of that be part of today, in addition to talking, actually getting to do something. So again, we'll go through some of that. So I'm just starting with this quote by Nelson Mandela. And one of the things he said is, it's one thing to be told of possible hardships ahead, and it's entirely another to have to confront them in reality. And I bring this up, and I wanted to share this quote because I think someone actually alluded to this, like in what hasn't been helpful in your mental health. And it's this idea of like, just think positive, or things are going to always be okay. And the reality is they aren't. There are going to be moments that are really hard. And, I think whether you're dealing with a chronic health condition or not, it's actually part of being human, that there are going to be moments that are wonderful and highs and celebratory and joyful and all of those things, and there's going to be things that we encounter that are hard. And I think being able to acknowledge that is really important, because I've certainly seen and sometimes experienced as a psychologist working in a rheumatology clinic and otherwise, where I would get a referral saying, this person is distressed, please see them. And sometimes it was the best referral and they absolutely needed support. And other times I would recognize as a psychologist, well, this is just a really expected, normal, understandable response to something hard, right? Whether that's a new diagnosis or a treatment that hasn't been helpful, or other things like that. So I just want to start by just normalizing, and I think people have been talking about it. I think it's really important, because sometimes we can feel that we shouldn't be feeling upset about things, or that somehow it isn't okay. And I think it's important to recognize that it's a part of our experience. And that doesn't mean there's anything wrong with someone, or that doesn't mean it's a problem. These are human emotions, and it makes sense that we're going to have reactions. So just to normalize, I think it's going to come up, that at times you're going to feel angry or frustrated or discouraged or helpless, sad, depressed, overwhelmed, feeling different from other people, or maybe not feeling great about yourself, or worried about things. In and of themselves, these are all things that make sense to experience often in life. think it's also really normal that you might feel worried. You might have a hard time dealing with friends or family, right? Not everyone, people alluded to this already too. Not everybody understands. Not everybody will. Sometimes they will, sometimes they won't, right? So we're going to have hardships. Worrying about your future, what's going to happen. There's uncertainty in many cases, and that's a part of managing this. Having difficulties at school or your work. I also appreciate that comment. What's bad for my mental health? My boss. Like, yeah, right. Like, makes sense. Or a professor or a teacher or, a coach or a parent, these are all things. I think, it is normal at times to feel depressed. It's actually pretty common to have thoughts of harming yourself. Just having those thoughts doesn't mean someone will act on it, right? So, occasionally having thoughts of that in and of itself, it can be quite a normal thing. Sometimes for folks, it's normal to want to use substances, right? To try to cope too. These are things that, and again, we can chat about this in more detail, but it's normal that this might come up for people. Or, for those who are still in pediatric care, or those who are in adult care already, it's hard, this transition period that folks were talking about. And sometimes even after you've transitioned to adult care, that can still be hard, right? You're trying to find where your supports are, whether you can access what you need, developing new relationships with new health professionals, perhaps being in a different city if you're away at university or college or some other sort of program. So these are all things that understandably are going to, and again, it's not an exclusive list, right? You might have others you want to add to it. I wanted to take time, and maybe you've already gone over this today, but I'll just take a bit of time too. So it's like, we all feel anxious sometimes. We all feel depressed and sad and upset sometimes. But I always think it's important to step back and reflect and say, when does that cross a threshold? Or when does it say, actually, there might be something else going on too? Like, I might also be dealing with significant anxiety or significant depression that needs to be managed. So I just wanted to share a little bit about this too. So signs of anxiety and like more significant anxiety that's creating some impairment is if you're feeling nervous most of the time. So this is really like your normal state is to feel nervous. If you've got frequent nightmares, you've got signs of maybe panic, or you might actually have panic attacks. So your panic attack is really where you get some of these sensations like racing heart, sweaty hands and feet, feeling dizzy, difficulty breathing, feeling like you have pressure on your chest. Those can come to a peak, over the course of 10 to 15 minutes, sometimes longer, but then will come down. Those can be panic attacks. And real things, that fears that are so significant that actually prevent you from doing the things that you would like to be doing. So this could be things related to treatment, for example. So, if you've got such significant fear of needles, for example, that's creating it a hardship for you to actually be able to engage in the treatment that you need to do. But it could be other things as well. Sometimes for folks, they've had a panic attack somewhere, and so actually they don't go to that place anymore, or they feel like it's hard for them to leave their house, or they're just worrying kind of all of the time, so they're avoiding places or avoiding doing things because of that. And then the last kind of example there is like unhealthy habits that you can't break and take a lot of time every day. So these might refer to like compulsions or things we need to do, checking a lot, that takes a lot of our time. So we're talking like minutes, hours, sometimes in a day. So the real key thing with looking at anxiety is it's so significant that you can only do the things you need to do or want to do, but you're very, very distressed, or that you're actually avoiding doing those things. And that's creating a lot of impairment for you. So that's when we kind of say, oh, you know what, this is not kind of just normal fluctuations in anxiety that, are pretty typical to experience, but actually there's something more significant that maybe needs specific support around anxiety itself. In terms of depression, so the signs and symptoms of depression can include frequent problems with sleep. So this can include not like really, really struggling to sleep, so not getting very many hours every night. Or it can also be the opposite. So actually sleeping too much. So it's pretty typical for most grownups to kind of, or most folks to kind of fall into that, like 7 to 12 hours, right? There's actually a pretty broad range of what's typical. But if you're sleeping a lot, really struggling to kind of get out of bed, that can be a sign, can be one sign potentially of depression. If you're crying a lot, it can be. If you're often feeling hopeless or helpless that anything in your life is going to change. If you have a loss of interest, so things that you used to enjoy, or things that used to bring you enjoyment, and you just feel indifferent about them, or just don't have any interest in them anymore, that can be a sign. If you have problems with concentration or memory, you're often, sometimes we think about depression as like feeling really sad, but sometimes depression can actually be expressed through incredible irritability. So like actually you're just really irritated all of the time. That can be one way that depression shows itself. But it can also be if you're feeling sad or worthless, feeling like you don't have a future, or in some cases, thoughts about wanting to hurt yourself as well. So again, when we think about depression, of course, we're going to all have bad days. We're all, we might even have a bad couple of days, right? And that's okay. We still consider that to be normal fluctuations in mood. When we're really concerned that someone's dealing with depression as its own mental health issue, it's when we see that drop in mood or that change in mood that is there most of the time, most days of the week for at least 2 weeks or longer. So it's really something that's a significant change or drop in mood, and it's really persisting. And again, starting to interfere with your ability to do day-to-day things. So I just wanted to share these to say, both normalize like, hey, there's going to be hard stuff. You're going to be worried, that you may be worried quite a bit. You may have times when your mood is very low. But if you're really feeling like, oh, you know what, actually, as Katie's talking about this, some of these things are going, oh, maybe I might be dealing with significant anxiety or significant depression. That's a good time to kind of cue to say, actually, maybe I need additional support, specifically for my mental health, in addition to kind of more general coping with day-to-day life or stress. So happy to answer questions about that too, if that's helpful for folks. So I wanted to share today and just get a chance to talk a little bit about what can help us, both with that day-to-day stress, but also with some of these more significant mental health issues as well. And I often think about 3 things that are really supported by different types of psychological therapy. So some folks have clearly heard about cognitive behavioral therapy or CBT, which has a lot of great evidence for supporting management of pain, supporting management of chronic illness from a mental health standpoint, as well as primary mental health issues like anxiety and depression. Other examples are things like acceptance and commitment therapy, which also have great evidence behind it as well. It's kind of a version of cognitive behavioral therapy. And a lot of these therapies that have support behind them kind of have 3 pieces that we really target. So one of them is really targeting our nervous system directly and being able to do that through things like relaxation. So that's one piece we'll chat a little bit about. The other is our thinking habits. And I have a particular perspective as a psychologist who's worked for more than 10 years with folks with chronic health conditions, and it's not going to be think positive, I promise you. So we'll chat about what I think are some really helpful ways of thinking that are, I think, really, really valuable. And then the last piece I like to call valued actions. Really, this is just behavior. It's what we do. And so we'll spend some time talking and giving you the opportunity to think a little bit about like, what are valued actions for yourself? Like what actually matters to you? And are you engaging in some of those things, or do you want to be doing more of certain things that you've stopped or haven't been engaging in? So why relaxation? So we often still in this world somehow split our mind and our body. And really all of these things are so strongly connected. And, stress is and our nervous system, our fight or flight response can really be turned on. And our relaxation actually really helps to turn down our nervous system. It really helps to downregulate our body. So it can reduce the effects of stress, can give you more energy, can make you feel more alert, can actually also make you feel more in control, which when you have a chronic health condition that has uncertainty sometimes with it, ways to bring a sense of I can manage things and have some control over how I'm doing can be really valuable. Can help you think more clearly, concentrate, remember things better, right? So whether that's functioning at work or school, can help you sleep better. And what I'll tell you is sleep impacts so many things. We know that if we have trouble sleeping, that can impact our mood and our anxiety as well. And sometimes people find that um, uh, distressing to hear, but I think it makes sense to all of us. But I think for me as a psychologist, I think, oh, great. So in addition to being able to support anxiety and depression directly or stress directly, it also means if we improve our sleep, like it gives us another thing, right? If we can improve our sleep, that will have a cascading effect positively on our mental well-being. Being relaxed can help you enjoy things more. And if you do deal with pain, whether it's acute pains or short-term pains or chronic, more long-term persistent pains from your condition, relaxation can be really helpful to turn down the volume on our pain and support us in that way as well. You probably all have 10,000 different ways that you relax. And I saw some of those come up. There is no one right way to relax. Whether that's being outside, spending time with your pet, listening to music, having a hot bath or a shower, going for a walk, reading a book. There are so many ways to relax. I'm going to talk about breathing quickly. And I don't think breathing, sometimes it's sold as like the panacea. It's the thing that, we just need to breathe better. I don't believe that. We all breathe. You're all expert breathers, right? And breathing doesn't kind of change everything in the moment. But I like this quote from Russ Harris, who's a psychologist that really does a lot of acceptance and commitment therapy. And he says that slow, deep breathing is important because it's like an anchor in the midst of an emotional storm. The anchor won't get rid of the storm, but it will hold you steady until it passes. So I think I really like that because I think deep breathing helps to ground us. It's not going to take away everything, but it can help us find our breath in a moment, can help us give us a little bit of space from how we might react to something, give us a moment to kind of catch up, check in with ourselves. It can downregulate our nervous system. And so I think it's something that if we think about it as that ability to give us a beat and a bit of space from what's going on, as opposed to saying, oh, it's going to take away, all my pain or all my negative thoughts. It really gives us an intentional way to think about breathing. So it's really not overly complicated. And many of you have probably done this before. There's lots of ways to do this, but really all we need to do is take some slow, steady breaths. The key is taking them deeper into your belly, as opposed to up in your chest. Really, it's this basic skill. And what's beautiful about deep breathing is even just taking 4 or 5 deep breaths intentionally, so on purpose, while we're paying attention to them, can bring a lot of these benefits to us. So it's not something we have to do, for 15 minutes or anything quite that long. So just encouraging you to use deep breathing, but use it in a way that gives you space to respond and to ground yourself. The other one I want to talk briefly about is mindfulness. Many folks have actually heard, and I don't know if people want to put up their hands or say in the chat, have people heard? I feel like now everybody's heard about mindfulness. But really what it refers to is it just refers to paying attention intentionally, on purpose, in the present moment, and doing so in a non-judgmental way. So often our thoughts, particularly our worries or mood, focuses on things that happened in the past. So I would have done that differently, or that didn't go very well, or I wish that had been different. Or sometimes they'll focus on the future. So worry about, I don't know if I can handle that tomorrow, or I'm worried about what will happen to me down the road, whether it's specific to our health condition or not. So our thoughts can pull us kind of into the past or into the future, both being things we can't change, right? We can't actually change something that's already happened, and we can't actually predict or change what's going to happen in the future. So mindfulness can really help to ground us now. and give us the opportunity to say, I just need to respond to what's happening right now and how I'm doing right now. Again, it can also create a bit of space to say, what do I want to do right now? What feels important to me? Create that space for that valued action. I was going to show a video, which I'm not going to today, but one of the things that I think is important in how we think about mindfulness is mindfulness of thoughts and our thinking. So one of the things that I think sometimes people have been taught or told about is, how do we think differently, right? And I don't know about you, but I cannot control my thoughts. Thoughts pop into my head, random thoughts all the time. Some are really helpful. Some are frankly incredibly unhelpful, but they're thoughts. They pop up. And I think mindfulness is really helpful to also remind us that our thoughts are not facts. Thoughts are thoughts. And they come into our mind, but it doesn't mean they're true. And it doesn't mean we have to hook into them and believe them. So mindfulness gives us that ability to say, oh, like I hear that thought. Well, I'm thinking that, that might be hard or that's not going to go well, but that's just a thought. It's not necessarily true. And I can let it go. And so it's kind of recognition that that's there, but not feeling stuck or hooked. And just because we have a thought doesn't mean we have to act according to that thought or to believe it. So I think mindfulness can be done in so many ways. I'm going to share some links at the end and would love to hear from any of you. There's lots of apps, lots of guided mindfulness exercises. Some are 2 minutes or a minute, and some are half an hour. Then you can just do things mindfully in your day-to-day life, even reflecting on and checking in with your senses, like if you were washing dishes or cooking or listening to music, paying attention to, what do you hear? What do you see? What do you smell? What do you feel in your body? There's lots of ways that we can be mindful in our day-to-day. I'm going to do a bit of an exercise with all of you together. So it's a guided mindfulness exercise, but also something that gives us a chance to reflect on some of the things that matter to us. So you are welcome to turn off your video if you'd like, or you can leave it on and do what feels comfortable. You can close your eyes if you wish. Or just, if not, I would just suggest kind of lowering your gaze and relaxing. So what I'm going to ask you to do in this exercise is to bring your attention to a sweet spot in your life. And I'll tell you what I mean by that. I want to give you an example, because a sweet spot can really be actually a very simple thing. So for me, I have an almost 10-year-old daughter. In the last week, I, had a moment with her where they were getting off the school bus at the end of the day. I had rushed from work to go pick them up. It was really sunny outside. I could feel the sun on my face, and I got out and they ran up to me and gave me a big hug. It was a really small moment, right? It lasted 5 minutes or less, probably like 5 seconds. But I could feel the sun shining. I could see her smiling. I could feel her arms around me. And I could feel myself just kind of take a breath and be present. So for me in that moment, and I could smell kind of the crisp air. It's like the fall, but could still feel some of the chill coming in, but also the sun. And so for me in that moment, it was complete. There wasn't anything spectacular about it other than everything in that moment. It didn't need anything else. And sometimes those can be the best 2 minutes in a week, for example. So some other examples that might be true in your life. I don't know if you're a coffee drinker, but you take that first sip of coffee in the morning, right? It's got the milk or the sugar, however you like it. You can smell it. It feels warm in the mug, in your hands. And in that moment, everything is complete. Maybe it's when you crawl into bed, at the end of the day, and it feels warm. You've got your nice pajamas on, and you're feeling really cozy. And maybe you have a scent that you like, maybe you like aromatherapy and you've got that on. But everything in that moment is really complete. Maybe it's watching a sunset. Maybe these moments can be really, maybe it's like leaving work at the end of the day, or like closing your computer, when you finished a course for the day. So it can be anything, but it's really in a brief moment where everything feels complete. So I'm going to ask you to think about a sweet spot for you. It doesn't have to be like any of these examples. It can be something very simple, but I want you to think about something specific, something in your life, a specific instance of something sweet. Maybe it happened in the last week. Maybe it didn't. It can be anything. Maybe it's walking your dog outside. So I'll just give you a moment to see if you can think of and start to think of a sweet spot in your life. And I want, as you're thinking about this, to allow yourself to sit comfortably. Maybe with your feet on the ground, if you're sitting up, and just gently let your eyes close. I want you to start by noticing the sounds in the room or where you are. And then I want you to draw your attention into your own body. Slowly begin to notice the place where your body makes contact with the floor or the ground, with the chair that you're sitting on, and breathe. Draw your attention to your own hands. Notice their temperature and breathe. Now imagine your perspective shifts. Imagine that in front of you there's a photo album. Imagine that you open the album and reach in and take out a picture of you during that sweet moment. Let yourself draw that picture up from the photo album and feel it in your hands. Now imagine your perspective shifts and suddenly you are in the picture. See if you can let yourself be in that picture, in that particular moment. You can imagine opening your eyes in that place and kind of let yourself see what you see there. Let yourself notice the sensations that you feel on your own skin in that place. If you're outdoors, perhaps you feel a slight breeze. If you're with someone, you might feel the warmth of breath against you, the scent of that person's hair. Let it be as if you could just breathe that moment in, as if each breath just filled you with the sweetness of that moment. Let it be as if every cell in your body can feel what it is to be in that place. And now I'm going to ask you to gently let your eyes open and bring your attention back into this room. And when you're ready, you can put your video back on if you'd like. So normally when I've done this in a group, I've asked people like, what was it like for you? What was the moment that you chose? We don't have to do that today. But I want you to just think for yourselves, what about that moment was sweet? What about that moment really was connected to what matters to you? Maybe it was who you were with or what you were doing. But reflect for yourself where your sweet moment is. What does that tell you about what you care about? What feels important to you? The other purpose of this exercise is to really highlight that a rich, full life is built out of rich moments. These moments can be really simple, and they're special because they are connected to what matters to us. And sometimes we can miss even these sweet, small moments in our life because we're focused on kind of things in the past or we're pulled to the future. But actually, we can build a really wonderful life and not miss some of these really small, simple moments that are really important to us along the way. So thank you for doing that. So as you reflect on kind of what matters to you within that, it's really important to, I think I talked about valued actions. Values are really like a compass to us. So a compass gives you direction, keeps you on track when you're traveling, and our values do the same in our lives. So we use them to choose the direction in which we want to move and to keep us on track as we go. So I think one of the things I just encourage you all to do is to think about, and I'll put this on the next slide, a few key words. What's important or meaningful to you in each of these areas of your life? And perhaps there's an area here that isn't important to you, or there's another one that you would add. But thinking about, what matters to you as it relates to your own personal growth, leisure, what do you do for fun? What's enjoyable? What matters to you as it relates to your health? What about work or school? Family relationships, friendships, romantic relationships, and perhaps for you it's spirituality, perhaps it's religion, perhaps it's neither, and it's something that's really important culturally to you or otherwise. So I encourage you to just take a few minutes to maybe jot down some of the things or after today, checking in and saying, what matters to you in each of these areas of your life, and paying attention to, am I doing those things now? Or could I be doing more in those areas? If I chose to, what would I choose to do? And I say this because, I started the talk by saying hardships are part of life, right? They're going to happen. One of the things that we can do is make sure that we're engaging in things that actually matter to us, big things and small things, like the sweet spot that we were just talking about. When we're engaging in life in a way that feels consistent with what matters to us, it makes it easier to navigate through hardships and to carry those hard moments, those hard thoughts, feelings, urges, sensations along with us. So just encourage you to think about that. And values are great because values are kind of like each to their own. There's no values that we should all have, right? It's kind of like flavors of pizza. Like you might like pepperoni and I might like Hawaiian. Okay. For you, a certain value of honesty or connection or authenticity or being active or being confident or any of those things. There's not one value that's better than the other. So it's really just what feels like they matter to you. So I'm going to just keep us going here just in the interest of time. I want to leave time for questions. But here, if people want to take a screenshot of this or think about it, this is one way we can make a bit of a plan. Each of you could make a bit of a plan after today to say, what do I want to do more of that really matters to me? If you reflect in each of those areas, and you can start small, I encourage you to be specific with the goal. Think about what matters underlying that goal and what actions you take to move in that direction. For people, sometimes starting to engage in valued activities might think thoughts, memories, urges, sensations, difficult things might come up. So what might those be? And what are you willing to make room for? For example, if you deal with chronic pain, it might be really important to you to be active. So you might say, oh, I want to go for a walk, with my friend or my dog or, my parent or my partner. And I'm going to make room for the fact that maybe there is going to be a bit of pain that comes up for that. Or I might be a bit worried about whether it's going to make it worse. So remind yourself what would be useful to remind yourself to help you in that moment? And if the goal you're setting is too big, how could you break it down? Or maybe it won't be, but if it is, how would you plan ahead to break it down? And then thinking, what is the smallest, easiest first step I need to do? And think then really practically, when will you do that? So if we can break these things down, this can really help us start to engage more in some of those valued actions that really, really matter to us and move us in that direction. That's it. That's where I'm going to end, and time for questions and conversation. I feel like we could talk about mental health and coping strategies forever. So this is just a little snippet of things that I hope have been valuable to you. There's some great resources there if you do deal with pain. The Power Over Pain portal and the Comfortability program have some great resources online. If you deal with worries of any kind related to your health condition or otherwise, Anxiety Canada has some great tools. And I always just think it's important to share there's distress lines out there. So if people are feeling like, I do have thoughts of harming myself or hurting myself in some way, there are lots of supports available via text too, even, which can feel more accessible and supportive for folks, and lots of apps. So maybe there's people want to share some apps, I don't know, that they like or that they found helpful along the way. And I know Andrea already talked about this, but just to encourage you to access other supports that you can. I know sometimes what's available in pediatric care versus adult care is dramatically different, especially in terms of mental health supports through rheumatology clinics. So I just acknowledge that. And just encourage you to think creatively. Sometimes there's access to supports available through benefits, whether it's through your parents or your own jobs over time. And also, if you are in a university program, for those of you in that stage, accessing through on-campus kind of supports can be really valuable. The other thing I like to say is if you're looking for a psychologist or social worker or counselor in the community, if you have the ability to look through something in private practice, sometimes you can, if you really are looking for specific supports more around your chronic disease, you can also look for folks who trained or used to work in hospitals as mental health professionals. And those folks can be a little bit more well-versed in kind of supporting whether it's pain or dealing with treatment challenges or needle fears or other things like that. And so that's just one way, because I sometimes find if you just look for a psychologist or a social worker or counselor online, it can be very overwhelming how many people are out there. So those are things to kind of look for or ask about that might increase the likelihood that you'll find someone that feels like they've got the right background and training and knowledge to support your chronic disease management.
Awesome. Thank you, Katie. I think we had one question that I think I missed earlier, and I'm so sorry to the person who asked it.
Yeah.
The question was, for these PEDS patients, how do you balance and manage the medication part? For example, if they're on biologics and then adding in additional medications for the other side effects or other symptoms, the anxiety, fatigue, whether that's due to rheumatic disease or some kind of deficiency, especially as the multitude of medications can also play an impact on the mental health. I'll also copy that into the chat.
Yeah.
Yeah, I'm not sure if you covered that, but I think I missed it, so my apologies.
No, that's okay. I can answer somewhat for sure. I mean, there are things to pay attention to and to be aware of around certain medications, right? So I know I saw Lori mention about methotrexate, right? Like anticipatory nausea, the idea that you kind of can feel anxious leading up to that or down after that. Like there can be things that, are not just related to how you cope with it, but sometimes impacts of, medications themselves that are just useful to kind of be aware of and to plan for and to create some good strategies around, right? I know I've worked with some folks who, whether it's leading up to an infusion or regular injection or other medications, they might be thinking about that for days ahead of time, right? Or they notice their mood changes knowing that, well, that's what I do on Wednesday night or Friday night or whatever it is. And so, plan accordingly in terms of, what you build in to help yourself cope, whether it's leading up to that or after that, specifically plan things that you think feel good or specific, whatever that is, or, things that that really support yourself. And folks may have good suggestions based on their own experience around what that could be. Could be being with certain people, planning certain things, activities that you do. And I think recognizing, especially when you're starting new medications or you're making decisions about medications, you might have worries about it. You've learned about potential side effects. You don't know if you're going to have them, right? You might be kind of feeling a little bit vigilant about that, or thinking or worried about that. Those are things that you can recognize too, like going into transition points, starting new meds, stopping certain medications. Change is hard. So change can make us feel worried, right? So also just recognizing, that's where I think normalizing some of these things, that, okay, that might happen. Just because it's happening doesn't mean it's going to stay forever too, right? Like recognizing sometimes things will pass, and just making a plan to support, what you need for that period of time, recognizing I'm going to get used to this, or, like things will, when we change, sometimes there's just an adjustment period that we need to kind of boost our supports around for a period of time, whether that's things we're doing on our own, so planning and building in relaxation, and other coping strategies, or whether it's for a period of time having extra supports like a psychologist or social worker or counselor. And I think Andrea did such a nice job also of indicating, you can ask rheumatologists or nurses in clinics and otherwise to say, hey, are there side effects or other symptoms from this medication that would be helpful for me to know about in terms of my mental health or other areas of my life? Those are great questions, and really, if they're not already bringing those up, certainly valuable and reasonable to be asking about. Hopefully that answers the question a little bit. And recognizing things like fatigue, right? Fatigue can be really hard to deal with. And it's, recognizing that we can't relax our way out of fatigue sometimes too, right? But we can kind of proactively, this is where I think, proactively planning and building in relaxation into our kind of daily schedule, kind of like exercise, or kind of like eating and drinking, all these other things, even if they're brief, can really help us, so that those moments are less frequent, or if they do happen, we feel like we already have the skills to manage them. So sometimes I will say to younger kids, especially, like, you don't learn how to free throw in the NBA finals. You've practiced and practiced and practiced and practiced and practiced and practiced and practiced, so that when you're in that kind of heat of the moment, that maybe feels more stressful or more challenging, it's habit. It's just like muscle memory. You just do it. So I think those are ways I think about it too. It's like building up your free throw skills so that when you need them, you got it. You don't even have to think about it.
And then thank you. We had another question. If you can answer it quick, that'd be good. I think we're going to need to move on soon. And I'll send it to the chat, but it is, how do you get your patients to implement these habits like mindfulness, and how do you follow up on that?
This is a great question. It's like the secret sauce to how do we get people to like do certain behaviors. The answer is very hard. So I'll be totally honest about that. I think what I will say is a couple strategies that can be helpful. I think the last bit where I said, when, like, actually planning when you're going to do something. So not just saying I'm going to do mindfulness, but it's like, what day, what time, what are you going to use, right? And already having that picked out ahead of time. I find especially, mindfulness is a skill, right? It's something we have to practice, which is why some of the guided mindfulness exercises are great, because all you have to do is listen, right? You don't have to kind of do it on your own. So it's sometimes when people are learning something, it can be easier. The other thing I say about mindfulness is there are so many guided mindfulness exercises out there that if you don't like the one that you found because you don't like the person's voice, you don't like the focus of it, you don't like the pace of it, okay, move on, find a different one. There's no one kind of right, perfect way to do it. So just listen to your gut, right? It's got to be something you find valuable. So those are some kind of things to think about. And I was going to add something else, but it's just escaped my mind. So I don't know if people have, maybe Natasha, if people wanted to share that either separately or in the chat or direct messages, but there's a lot of apps and other things that people use that they find helpful to along the way.
Yeah, for
Yeah,
sure.
and we'll also send out a big like resource package too at the end of like our day too. So if either you, Katie, or Andrea, or really anyone else here has some like resources or apps or things that they really enjoy using, you're more than welcome to send it over to us and we can look at including that in our package. I think that's all the time we have for questions.